In today's presentation, I am excited to introduce Cindy Lazenby, the founder of Foot Canada Training and lead author of Art and Science of Foot Care, a multidisciplinary resource, now in its third edition. Cindy has an extensive history of providing nursing foot care education and advocating for improvements in nursing foot care in Canada. Today, Cindy shares with us her unique experience as a new nurse in the 1980s and how her dedication to improving the care she was providing to her patients is now helping patients and nurses all across Canada. We will learn about how finding key mentors early on in her career and her insistence on asking why have been instrumental in her success. In addition to being a registered nurse since 1981 and a foot care nurse provider and educator since 1993, Cindy is currently Foot Canada Training's education advisor. Since 1993, Cindy and her associates have trained over 5,000 foot care nurses and have over 24 educators across the country. In 2010, Cindy was the founding contributor and the first chair of the CAFCN, which is the Canadian Association of Foot Care Nurses, which aims to standardize best clinical and educational practices across the nation. Aside from being accused of being a little obsessed with feet by some of her friends and family, there are 4 other aspects of her life that give her a constant stream of joy: family, community, nature, and health and wellness. It would be an understatement to say that Cindy has had a lasting influence on the field of nursing in Canada and the trajectory of the foot care nurse as a specialty. Foot care nurses can now be found in all provinces, working in independent practice in their own or multidisciplinary clinics, as travel or mobile care nurses in the community, as professional colleagues in nurse practitioner clinics and family health teams, as practitioners in Indigenous territories and communities, as staff in long-term care homes and hospitals, and on contract in government or privately funded social services and community-based agencies providing care for the unhoused, underprivileged, elderly, veteran, or disabled populations. New nursing graduates have many amazing opportunities to learn about foot health and to use that knowledge to positively impact the lives of their patients. Let's take a few minutes to learn about Cindy's journey and the importance of foot health to patient outcomes and the role of the new nursing grad.
The first time I recall being aware of any foot problems with my patients was when I was working on a chronic floor of a New Brunswick hospital in my early years of nursing in the 1980s. I came across a dressing that was just too complex for me, and the patients had half a toe missing, and there was another toe that was black and had hardened with eschar. So I asked for help on how should I treat it and how do I prevent this from happening to anyone else. To be honest, I didn't even know what the term eschar was at the time. Like, feet and foot care were nowhere on our radars at the time. We were responsible for bathing patients, but when we did, we usually just stopped at the ankle and didn't know to pay enough attention to the feet, like drying between the toes. So the supervising nurse that I had asked, and she told me to just do a simple wet to dry dressings, which is what we used to do then, but no other direction was given. The next day when I returned, the toe had fallen off, and so I felt this deepening, sickening feeling in my stomach from the guilt, and also a sinking feeling from not being able to prevent it from happening to another patient. So fast forward a few years, when I noticed some patients had these great big toenails. They were very thick, they were discolored, maybe yellow, and it was in a hospital. And I asked, so how are we expected to care for these? And I was directed to the nursing station. So off I go to the nursing station to look for what was called a foot care kit. And there was an uncovered basin with a pair of previously used scissors that were open, and there was nothing else. So I recognized there was a huge knowledge gap, and I felt that I needed to do something about it. So I set some personal goals to search for wound and foot care courses and to learn more about diabetes. However, back then there were no there was very few wounds or foot care courses for nurses, and the organizations like Wounds Canada wasn't as robust as it is now, and there was no such association of the Canadian Association of Foot Care Nurses back then to support and to guide us. So, but it wasn't until I moved to Kingston, Ontario in the early 1990s that I found some accessible courses that would meet my learning needs. So when my family and I moved to Kingston, Ontario, I was lucky enough to meet Dr. George Mary at the St. Mary's of the Lake Hospital, who ended up being my teacher and my mentor for foot care. And luckily I had mentioned to the director of nursing at the hospital during my interview that I wanted to become a foot care nurse. And so she directed me to find Dr. Mary on staff. He was a family physician originally who took interest in feet early on. He had started the first Wolf Island medical clinic, and then he opened a foot care clinic there and close to the ferry. He was later offered a position at St. Mary's of the Lake Hospital in the geriatric assessment team, and that's where we finally met. I decided I might as well complete the foot care courses were available. There were 3 of them at the time. It took me 2 years in between working and a life to get them under my belt. First, there was a 2-day basic theory course, and that consisted of a series of lectures. The second course was also 2 days, and it was called an advanced course, which several teachers were in different rooms, and there were about 6 students per patient. And the third course was also 2-day, and it was called the diabetic course, where we watched the clinical demonstrations, but we weren't allowed to touch at the time to treat the patients. And Dr. Mary offered the courses privately to nurses and to other allied health professionals with his professional colleague, Lynn Rutherford. Lynn was an occupational therapist that also worked at the same hospital as we did. Dr. Mary was kind enough to accept my offer when I was finished all 3 courses. I offered to volunteer my services alongside him a couple of days a week at the foot clinic that he worked at for about 3 months. And he was so encouraging. He was so wonderful. I gained my confidence through him, and I improved my competencies. He encouraged me to work in the community after the 3 months and to call him whenever I needed support or to refer the more complex clients back to him. He also asked me if I wanted to start teaching the advanced foot care course with him, and then even encouraged me that if I wanted to continue teaching on my own other courses if I felt that there was a need and I wanted to. So thanks to his encouragement, I went ahead and I was able to continue on my journey, which I felt very passionate about. I wanted not just to learn for myself and to be able to incorporate it into my clinical practice, but I hoped that by sharing my knowledge, it would help advance nursing foot care and reduce lower leg complications, in particular preventing amputations. Also, there are too many other multidisciplinary healthcare colleagues to mention that also made a big impact on my journey by mentoring or teaching me with all kinds of other foot-related competencies, namely wound care, diabetes care, orthotics, biomechanics, and infection control.
Why is foot health so important to overall patient health and to positive care outcomes?
Feet, they are a severely overlooked part of our bodies, mainly because they're at the furthest extremity of our bodies, and we seem to just sort of take them for granted. They're quite literally the furthest thing from our minds. The realization that we take our feet for granted can usually happen after an accident or an injury to your legs, your ankle, or your foot. That's when you realize how much you rely on your feet every day to stand up, to sit down, or to get out of bed, go to a shower, not to mention getting to and participating on social activities, educational activities, employment, physical activities, and spiritual activities. even boring old house chores. You need your feet. These activities may be possible without your feet or limbs. The loss of a foot or a limb could require a lot of accommodation and adjustments. It is possible. It is more difficult. It also can be financially burdensome, socially isolating, professionally detrimental, physically impossible at times, and emotionally draining. So a person who loses the use of a lower limb, even if it's temporary, is at risk of losing their employment, their income, their hobbies, their mobility, and their independence.
What are the most common foot health concerns that your patients might come in asking about?
Nurses should be prepared to speak to their patients about how the foot is involved and proper lower limb care as it relates to either arterial and venous insufficiency, different types of wounds, differential diagnosis of fungal nails, diabetes and comorbidity, arthritis, peripheral neuropathy.
And what about those foot health concerns that the patients won't come asking about? The ones they are too embarrassed to admit to, or that they don't even realize they should be asking about?
So even though your patients aren't likely to ask, you should be prepared as a nurse to initiate the conversation with patients that are at risk for foot complications, such as they don't even think about if they have proper circulation by their feet. They might think about circulation as, the pulse in their arm or maybe in their neck or their heart, but they don't think about that there's pulses down by their feet, and that's a measure of whether they have proper circulation down by their feet, or that do they have proper sensation. Could they tell if there was a tiny little rock or a medium-sized rock in their shoe that could be doing them harm? Do they know that they could be looking for temperature differences, swelling, color, and do they have tingling or other sensation or no sensation? They say, no, my feet don't hurt at all. That's usually a measure that is a bit of a red flag. And what are appropriate shoes for the patient? Considering that we've all are guilty of picking maybe pretty shoes or the shoes that are in style or the shoe that's on sale. We really have to look at people that are at risk for lower limb complications and maybe at risk for falls or for wounds. Do they have the proper shoes? Do they fit their feet? Are they the right size? Do they have the right support? And do they have some pressure points looking at their feet? If you see some red areas, those are pressure points. They're obvious. And you can point that out to the patient that they could be assessing and looking at their feet every day and noticing it and knowing when to call you. Also, what about pain due to varicose veins? For example, compression stockings might be helpful if they have varicose veins and if they have venous insufficiency but not arterial insufficiency. So that's a whole other topic, but compression stockings can really help reduce some pain, and people just live with pain in their legs sometimes and not even knowing if there's something they can do about it. And diabetes, what is it that puts a person that has diabetes more at risk for ulcers and for infections and amputations and hospitalizations and comorbidities? Have a conversation about retinopathy and heart disease and nephritis and peripheral neuropathy, and what type of assessment and special care should they be getting, especially for their feet. And with every visit in primary care and in other settings, smoking cessation needs to be brought up. And if a person is at risk for foot complications or has a wound, you must bring up smoking cessation for the client, because maybe they don't realize that smoking reduces circulation at their extremities.
Cindy, what do you think is the one thing that a new nurse could learn about foot health that would be the most impactful on their patient's well-being? I'm sure it's hard to decide which one.
Well, I feel like the single most effective way for a nurse to improve the quality of the care of all their patients in all their settings would be to learn how to use a validated foot screening tool, such as this one that's on the screen. It's the InLo 60-second diabetic foot screen. This tool will help you quickly assess a patient's risk for foot and lower leg complications and then refer based on the score. You don't need to be a foot care nurse. You could be an allied health professional, a brand new nurse, a nurse that's been a staff nurse for years. Anyone can use this once they get just a bit familiar with it. And it provides a qualitative and a quantitative report that you can add to the patient's chart, and in just 60 seconds, you can assess for skin, nail integrity, peripheral sensation, pain, circulation by assessing their pedal pulse, their foot and toe shape. Are they deformed? Range of motion of the hallux and their footwear. And if they've had a previous or an active ulcer infection or Charcot foot or a lower leg amputation. This risk assessment is so useful for any patient and in any nursing environment. Everybody has feet. It can serve as a baseline during admission procedures, similar to when you're screening for falls or screening for skin breakdown. It can be part of the admission notes, progress notes during check-ins and rounds. It can help with internal and external referrals for extended care. And there are updated versions of this screening tool and any screening tool that's being produced regularly. So you always look for the most recent one. So nurses can effect more change when it comes to foot health by taking continuing education in diabetes, wound care, and or taking nursing foot care courses.
During the pandemic, Foot Canada Training developed the Daily Foot Health Checklist. Cindy, can you explain to us why is it so awesome and how can it be used in different settings to affect change?
The Foot Canada Training Daily Foot Health Checklist offers nurses and allied health professionals, patients, and caregivers a way to monitor foot health daily during routine activities, like dressing and bathing. And with very little to no training, a person can work quickly through the checklist and monitor for normal conditions, normal signs and symptoms, and also abnormal signs and symptoms. It's not a way to diagnose, but it's a way to identify and improve some improvements or changes and alerts for care providers to symptoms that may require more attention, or it may require referrals to a professional. Now, the red light and green light nature of this checklist makes it easy for patients to use on themselves also, with obvious visual cues and reminders that the users of all the aspects of the foot health that should be monitored. So when they are often overlooked. So if this checklist was posted, let's say in long-term care homes, in bathing areas, in physicians' waiting rooms, added to a daily charting procedure, and sent home with the patients that are being sent home, those that are at medium or high risk assessment scores, then the potential for improved qualitative outcomes for patients, such as improved overall health, early intervention, and decreased amputations, they could retain their independence. It's kind of obvious, but not to mention the financial and quantitative impacts on the healthcare system with the reductions of hospitalizations, shortened length of wound care recovery times, and increased opportunities for aging at home and reductions in amputation-associated strains on the healthcare system, such as rehab therapies or occupational health and home care services. Well, with this daily checklist, it will help the patients to go through systematically, and if they notice any changes or differences, differences unilaterally or bilaterally within their lower legs in changes of color, temperature, texture, odor, or the size of their limb or of their nails, that's when they should report. And they should report also if their feet feel different or they have a different sensitivity, if there's unexplained or inconsistent bruising, coloring, or injuries of their legs that they hadn't experienced before. The patient all of a sudden can't put their shoes on anymore, whether it's because of flexibility or because there is edema in their feet. And maybe edema is a cause of something systemic, or maybe there is a local infection in their feet. The patient may not be able to wash their own feet or care for their own nails or skin or be able to see, then that is something to report because they require some help. If the patient has diabetes, peripheral arterial disease, or other circulation conditions, that's another time to report. And if the patient is having repeated falls. And that's just a short list.
What do you think the role of the new nurse graduate is in the promotion of foot health?
Great and important question. What's the role of the new graduate nurse? How can they play a role in this? Well, the field of nursing foot care is growing and changing so rapidly right now. But it's happening mostly in a postgraduate environment. So motivated, interested nurses can seek information, new information, and they can push for standards of care and curriculum in their policies and procedures. If there is a new standard that comes out nationally, then it needs to be reflected in their policies and procedures. But this sometimes goes relatively unnoticed amongst the rest of the nursing and medical world. It's just sort of insulated. So the advancements in infection control, prevention and control, and diabetes and wound care and patient education as it relates to foot care could be so much more impactful if the changes and the practice were acknowledged and adopted outside of the foot care clinics. So actively talking about foot health with colleagues and with patients themselves will create open dialogue about standards of care and best practices and awareness. That's a thing. Nurses may notice gaps in their knowledge, as many undergraduate nursing curriculums don't always emphasize the role of the foot care nurse, and they should be looking for ways for current research and courses to advance their knowledge. So while you may find some colleagues eager to mentor you, nurses should keep in mind that foot care standards and training have remained unregulated all this time, and therefore there's lots of variations in techniques, in tools, in standards. Attitudes remain quite prevalent, these differences. So new nurses should ensure that their mentors have kept up to date with continuing education opportunities from credible sources.
What kind of training is available for nurses who want to learn more about foot health?
Well, you might find some repeating themes in my response to this slide. From previous slides, nurses can find many continuing education opportunities online and in person that will teach them about foot health, diabetes, wound care, infection control, and prevention. ABPIs, ankle brachial pressure index, compression, offloading, padding, gait analysis, orthotics, dystrophic nails, treatments. There are so many different ones, but not just the treatments, but also diagnosis or differential diagnosis of nail dystrophy. And some of these courses you can take as an undergraduate, so there has been some movement that way to open it up to students, at least for the theory part. And then once you graduate, you can take the clinical part. Although foot care nurses across Canada vary in their settings, in their hours, in their curriculum, best practice is if you're going to look for a course, look for a curriculum that integrates all of the 95 advanced nursing foot care competencies that have been laid out by the Canadian Association of Foot Care Nurses, and they did this in 2017. You also are looking for courses that have both a strong theoretical component and a strong clinical hands-on component that's taught by experienced foot care nurse educators, and that they offer a certificate of completion. So you do have to be assessed and you need to meet the minimum requirements and competencies to pass. Now, the CAFCN, or the Canadian Association of Foot Care Nurses, I'm so happy to be able to say this. They are currently working with the Canadian Nursing Association, that's the CNA, to work towards a nationally recognized accreditation and or certification. And in my mind, CNA is the primary authority responsible for developing certification programs for nurses across Canada, and have been for a couple decades. And so I am honored that I've been asked to be on the certification committee this year, and I look forward to checking this off my very long 20-year goal.
A very special thank you to Cindy Lazenby for sharing her journey and her passion with us today. If you'd like to learn more about foot health, the resources listed on this page are a great place to start. You can always reach out to Cindy and the team at Foot Canada Training for more information. Find us at www.footcanada.ca or send me an email. I'm Julie at footcanada.ca. Thanks for listening.